Hello everyone, welcome to another video. In today's video we are going to be talking about congenital rubella syndrome. This congenital rubella syndrome, it's actually a group of serious birth defects that occurs when a pregnant woman becomes infected with the rubella virus, especially during her first trimester of pregnancy. So this rubella virus, it can cross the placenta and can infect the unborn baby, leading to permanent damage to the baby's developing organs. Rubella generally is also known as German measles, and it is generally mild in children and in adults. However, when it comes in pregnancy, it becomes dangerous because the virus interferes with the baby's growth and the baby's development. So this congenital rubella syndrome is actually preventable if the mother goes for the routine vaccination before pregnancy. So during pregnancy, the placenta allows oxygen and nutrients to pass from the mother to the baby. However, it can also allow certain viruses like rubella to enter the baby's bloodstream. So if rubella infection occurs early in pregnancy, especially within the first 12 weeks, it can significantly interfere with the formation of the baby's eyes, the baby's ears, the heart, and the brain. And the baby's immune system is not yet fully developed, so it cannot actually fight off the infection. So because their immune system is not strong, they can't protect themselves from this infection. So it allows the virus to replicate and cause permanent damage in the unborn child. So looking at the pathophysiology of this congenital rubella syndrome, the rubella virus enters the mother's bloodstream and it crosses the placenta to infect the fetus. So the virus targets rapidly dividing cells, disrupting organ formation and cell signaling pathways, and it can cause cell death, it can cause delayed cell development, and it can also cause persistent infection within fetal organs. So these effects, they vary depending on the gestational age at which the infection occurs. So for the first trimester, the first trimester has the highest risk, up to 90% chance of fetal infection with severe consequences. But after 20 weeks, the risk of major birth defects is usually very low. So what causes this congenital rubella syndrome and what are the risk factors? So what causes is basically maternal infection with the rubella virus during pregnancy, especially during the first trimester, and the lack of vaccination before the pregnancy. And also if there are like outbreaks in unvaccinated populations too. So the signs and symptoms that is seen in the baby, like this congenital rubella syndrome, it can affect multiple organs, and the common features will be like eye problems, like there will be presence of cataracts, like clouding of the lens, glaucoma, which is increased eye pressure, pigmentary retinopathy, which is a damage to the retina, and blindness too. Then hearing problems like sensorineural hearing loss, which is also known as permanent deafness. Then these hearing problems, they're actually the most common symptom that is seen in this congenital rubella syndrome. Then heart defects too, like there's a heart defect known as patent ductus arteriosus. So this is when a blood vessel, like this is a blood vessel that fails to close after birth. And then we also have pulmonary artery stenosis, which is the narrowing of the artery to the lungs. Then some neurological problems too can occur, like developmental delays, intellectual disability. Then microcephaly can also occur, that is presence of small head. and some behavioral disorders. Other signs can be like the baby will have low birth weight, enlarged liver and spleen, skin rash at birth, which is called blueberry muffin rash, and some bone abnormalities. So some conditions that may present with similar symptoms like this, like we see here, for example, congenital syphilis. So in congenital syphilis too, you can see the similar symptoms in the baby. Then also Zika virus infection and some genetic syndromes like Down syndrome, and also cytomegalovirus infection. So all these conditions can mimic similar symptoms to congenital rubella syndrome. So for the diagnosis is based by is made by a combination of, number one, getting the maternal history. So if she had like rubella-like symptoms during symptoms during pregnancy, and if she did not get the rubella vaccine before pregnancy. And also laboratory tests are done on the baby, like detection of the rubella virus in the baby's blood, the baby's urine, or through a throat swab. Then blood tests are also done to showing the rubella specific antibodies like immunoglobulin M type, which indicates like a recent infection. Then PCR, that is polymerase chain reaction, can also be done to detect the viral genetic material. So imaging and certain examinations like eye exam to check for cataracts, retinal damage, echocardiogram to check for the heart function and everything, and also some hearing tests, brain scan. So all this can be done during the diagnosis. So for treatments, there is no cure for congenital rubella syndrome. Management is usually supportive and symptomatic, aimed at improving the quality of life of the child. So number one, giving hearing aids or cochlear implants for deafness, then eye surgery or visual aids for cataracts or vision problems. In cases of heart defects, some cardiac surgeries may need to be done, and early intervention therapy for developmental delays, and also regular monitoring and therapy for learning and behavioral issues. So basically, it's good that pregnant women are given the proper education that they need about like pre-pregnancy vaccinations, and they should be encouraged to do rubella immunity screening before conception. And some preventive strategies that can be done in this case is just basically to get the rubella vaccination, which is part of the measles, mumps, and so it's a combined vaccine. So this is usually highly effective. And then try to avoid pregnancy for at least 1 month after receiving this vaccine. And it's good for pregnant women to do screening for immunity during like antenatal visits. And if it has been known that a pregnant woman has this rubella virus, it's good to isolate the infected pregnant woman, just so she can't spread to prevent her from spreading the condition. So in summary, in this case of congenital rubella syndrome, it's just good to take proper prevention, take proper preventive strategies, because there's no cure. Like if you give birth to a child with all these conditions like deafness, blindness, vision problems, heart defects, behavioral issues, developmental issues, there's no cure for this child. Like this this has to be the new reality of the child. So it's just better that if you know you are planning to conceive, try to get all the necessary vaccines that you need to get before you conceive. Even if you feel like, oh, you took the vaccine one period of time and you took this one, just try to go to the hospital, because if you've taken this rubella vaccine, it can actually show in tests that, okay, you've taken this vaccine. So just go to be sure that you've taken the vaccine. So in summary, this congenital rubella syndrome is preventable, but is a serious condition caused by maternal rubella infection during pregnancy, and it can result in all these defects that I mentioned, and there's no specific treatment. So prevention through vaccination is the best thing that you can do as a soon-to-be mother for your child, because this effects are long-term, and you don't want to be thinking like daily that what if I did this, what if I did that. Just try to take the proper prevention strategies before going into any of this. So that is basically the summary of this topic known as congenital rubella syndrome. So like I said before, it's good that we try to protect these unborn babies and prevent maternal infection. So I'll see you in the next video. Thank you for watching. Bye.